Hi everybody. In the last several videos, we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2018, 2022, and current clinical trials. In the last several episodes, we've come back to the cognoscopy. Dr. Bredesen's evaluation is screened for all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the important nutrient lab marker, vitamin B12. Next up, we're getting into vitamin B6, another important B vitamin lab marker to keep track of. Okay, so how does vitamin B6 relate to brain health? Well, let's first start with what we talked about on episode 38, homocysteine. If you remember, elevated homocysteine above Dr. Bredesen's target ranges is extremely inflammatory and damaging to our blood vessels, brain, and nervous systems, and is a strong risk marker for heart attack, stroke, and dementia. To prevent homocysteine from rising, we need our methylation cycle to run efficiently. And for this, we need key B vitamins. One of them chiefly being vitamin B12, which we talked about in the last episode, but another one being vitamin B6. So, B6 is an important cofactor for enzymes in the methylation cycle, but it is also necessary for normal red blood cell production, DNA synthesis and regulation, nerve function, energy production, helping convert nutrients we eat into energy and helping maintain steady blood sugars, cognitive function, the production of neurotransmitters, immune function, the production of antibodies to fight off infection, and healthy brain development during pregnancy and infancy. Symptoms of vitamin B6 deficiency can present as anemia, fatigue, red swollen sore tongue, dry cracked lips, scaly itchy rashes on the skin, peripheral neuropathy, that's the numbness, tingling, and prickling like pins and needles in the hands and the feet, depression, confusion, irritability, nervousness, difficulty concentrating, and short-term memory loss, weakened immune function with recurring infections, exceptional irritability and inconsolability in infants, and seizures. B6 deficiency is no joke. Now, listen to this. Standard of care's normal lab value range for B6 is between 5 and 50 micrograms per liter. We'd typically be given a clean bill of health walking around with these levels of B6 in our blood. But Dr. Bredesen's team has seen that these low levels are promotive of cognitive decline. They definitely don't prevent it. Anything between 30 to 50 micrograms per liter is really the low end of the range for Dr. Bredesen. And anything below 30 might as well be deficiency. Dr. Bredesen's team has seen optimal and improved cognitive function in patients with a B6 blood lab range of 60 to 100 micrograms per liter. To go beyond normal and get our B6 levels into the optimal ranges, we first need to know how deficiency can happen in the first place. Common causes for B6 deficiency have been not getting enough in our diet, excessive alcohol consumption, kidney disease, and digestive dysfunction like Crohn's disease, celiac disease, and ulcerative colitis, causing malabsorption. Please check out episode 27 for Dr. Bredesen's recommendations on healing the gut and improving digestive function, and also check out episode 16 for Dr. Bredesen's anti-Alzheimer's diet to cover all our nutritional bases. The current recommended daily intake for B6 is between 1.3 to 1.7 milligrams, and the highest B6 concentrations can be found in foods like beef, chicken, pork, lamb, turkey, organ meats like liver, fish like sardines and salmon, and dairy. Some plant-based sources are potatoes, dark leafy greens like kale and spinach, carrots, avocados, and chickpeas. Because digestive dysfunction has become more and more prevalent and the average nutritional value of our food supply has also diminished, Dr. Bredesen also recommends supplementing with the activated methylated version of B6. The majority of B6 supplements on the market are in the standard form of pyridoxine hydrochloride, which gets absorbed poorly and has to go through a couple enzymatic steps to be converted to the active version of B6 that can actually be used by the body. That active version of B6 is called pyridoxine 5-phosphate, but as a supplement, you'll often see it abbreviated as P5P on the bottle. So, to recap, Dr. Bredesen's optimal B6 blood lab range for optimal cognitive function is 60 to 100 micrograms per liter, and since optimal B6 status typically with the help of B12 translates to improved homocysteine status, Dr. Bredesen wants us to check these lab values against our homocysteine levels, which should be between 4 to 7 micromolar. And I'd love to hear from you. Has your neurologist ever spoken to you about B6 levels? What do you think of this video? Drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve, and please like and subscribe as it helps our community grow. And remember, I'm not a doctor, I don't have a PhD, I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.